So we're just going to get started now with the week of May 8th. And that started us off with our Movement for Movement Monday. Now, we talk about this all the time. Just going to be as a reminder, back in 2020, coincidentally enough, before COVID, our theme for the year was we wanted to create this movement about movement. We wanted to get people in the community feeling comfortable with doing whatever the doctors say you can do. So if the doctors are telling you that you can walk, then you should walk. It's good for you. And if you're struggling, you should talk to the doctors. And if doctors tell you you can go for a run, you can go for a swim, and you're trying to do it and you're struggling, again, you need to share that with your doctors. But a lot of us tend to become very fearful because we're in this new body and we're not sure what we're feeling, all of our sensations. So then we tend to stop moving. And that's what you don't want to do unless you're communicating that with your physician. So we also recognize that doing nothing sometimes is doing a lot. It just might be what your body actually needs. But there is a practice that you can implement, of course, clearing it with your doctor. It's called Qigong. Now, I don't know how many of you have heard of this before. We actually did this in our mindfulness session that we've had here in Aortic Hope, but according to an article titled 6 Potential Health Benefits of Qigong, a TCM mind-body practice, which was written by Lauren Badowski in Everyday Health. Badowski actually says that Qigong is deeply rooted in traditional Chinese medicine. That's the TCM. And it's been used to promote and restore health for thousands of years. So I think something that's that old probably has a lot of merit to it. But though it wasn't formally called Qigong until the 1950s, that said, the Red Thread International Institute refers to Qigong as the world's oldest healthcare system. And practicing Qigong, it might actually help improve your fitness. It's going to help reduce anxiety and depression, lower your blood pressure, relieve chronic pain, strengthen the immune and respiratory systems, and just kind of improve your overall sense of well-being. And some other possible benefits of Qigong might be, as we talked about, relieving chronic pain. I put number 1, lowering your blood pressure. Of course, again, all of these benefits and just doing the act of Qigong needs to be discussed with your physician. But if you take a look at the article that was in this link, Qigong is really very simple movements. It is different than Tai Chi, if you've heard of that. And it is, it's nothing that's going to deal with isometric or holding your breath or straining. It's actually quite relaxing. And I do think it's something that you should take a look at. So when it comes to movement, if you're looking for something that's a little bit more gentler on the system, a little bit more meditative, if that's a word, did I just create that word? I'm not sure. This is something that you should take a look at that then. And you should talk to your physician about it. It's a great way to introduce your body back into moving after you've had surgery, or even if you feel a little stumped because you've had a diagnosis and you're feeling a little confused. So check that out. That is our Movement for Movement Monday.